So our first question is actually for you, Mr. Stevens. And it's about Interpol's 5-year strategy for counterterrorism that started in 2016. So there are 5 action streams defined for assistance to the member countries. The weapons and materials stream refers to the identification, tracking, and interception of the illicit trafficking of conventional materials as well as unconventional materials, such as biological agents. Could you tell us how Interpol is approaching this work stream as it relates to biological agents, and remark briefly on the stakeholders in this work stream and how Interpol engages them?
Well, first of all, thank you for giving our organization, Interpol, the possibility to explain what we are doing, because I think indeed it's very important to highlight to the public that police organizations worldwide have also a role to play in this topic. And for the translators, I will do my answer in English. Although my French is pretty perfect, my Quebecois is not at all. Yeah, Interpol indeed, as you mentioned, we launched a counterterrorism strategy in 2016. One specific topic is related to materials and weapons, such as nuclear, biological, chemical, radiological weapons. But also the other aspect is pretty important, also for biosecurity, because we think, well, if you're talking about bioterrorism, you need also a terrorist. So to eliminate bioterrorism or to reduce a threat in bioterrorism, we need to also reduce a threat in terrorism as such. And I think the last couple of months we made big progress in our strategy to identify terrorists. How do we identify terrorists with 192 member countries? Well, we have a platform that they can use to control names of people, to control fingerprints, to control pictures, to stolen and lost documents. And just to show you how successful we are more and more, last year around this time we had maybe 5,000 names of terrorists in our database. Today, before I left, more than 40,000. 40,000 names who are available for police agencies worldwide to control if someone is a terrorist. We have a second database for analytical purposes with more than 100,000 entities. And I'm just not here to announce you these successes, but the fact that these numbers goes up, we also arrest more and more people. If I say we, it's not Interpol as such, it's the member countries. More and more we see that member countries arrest people based on our notices on our platform. We also highlight the social media aspect on it, which is also important, I think, in bioterrorism, because people who would like to make a biological threat will also use the internet to find the stuff they need to make or even the biological agents. And we focus also on financing of terrorism, even if maybe all these threats doesn't need to be very expensive. I think we all agree every euro or dollar is one too much. And it also allows us to make connections between different terrorists by financial transactions. So let's say the first 4 action streams are focusing on the people, but as you mentioned, we have one action stream focusing on the weapons and materials. And for especially the biological threat, we have a really good functioning, specialized bioterrorism prevention unit. Bioterrorism prevention unit, as the word it says, we focus mainly on prevention and also responses. And I hope that everybody in the room is convinced that law enforcement has a role, if it's terrorism, to prevent and to respond when necessary. Now, how do we engage with the stakeholders? Well, as I said, we have 192 countries with whom we would like to engage. Now, it's difficult to engage with all of them at the same time, but for this, well, we, for instance, make written documents for them to support them. This year, earlier, a few months ago, we updated our biological incident pre-planning and response guide, which we send out to the 192 countries. We made a flyer for first responders if they encounter a CBRNE criminal scene, what to do, because let's face it, most of the law enforcement, they are not familiar with it, luckily. But if they encounter such a scene, they need to know what to do, who to call in their own country. We made also a communication guide because the police will receive a lot of questions if such a thing happens. So we made a communication guide and lots of other things. So All these documents we send out to engage with the 192 member countries. Now, we have also sometimes bigger events. And next week we will have a meeting, for instance, with Japan, who will organize the next Olympic Games. Bioterrorism is a threat during such a big event. Well, we will highlight all our knowledge and all these documents we made for them to be sure that they have it on the right place, on the right time. If we are aware, and that's important for everybody in the room, I think, if we are aware that a biological or another incident happens in one specific country, on one specific spot, we have a system that we take it in what we call, sorry for a technical word, a notice, which we can send out to 102 countries to make them aware, look, it happened in this country, that biological incident happened in that country. Please be aware it might also happen in your countries. And I think that's a powerful tool as well. And of course, we also put a lot of effort and time and energy to capacity building and training. Together with some donors, and I think here I can say Canada is a very good donor of our project, we reach out to member countries to increase their level of awareness, increase their level of capabilities in this domain. For instance, we organized with a very important country, and I know there's press in the room, so forgive me if I don't mention the country, because the investigations are still going on. But with the financial support of Canada, we went 3 times in a row to one specific country to train them in 3 different topics. For instance, a bioterrorism risk and control workshop, where we train them about the risk assessment, where we train them how to secure labs, how to use the internet in your favor to see if something might happen in that domain. And again, with the funding of Canada, we were able to buy them equipment and to train them on the use of that equipment. Now, is it just theoretical? Well, some might think. That specific country, within a few months, intercepted 3 different containers, well, containers, I mean packages of ricin going out that country. The months after the training, the months after they received the equipment. So I think we focus to the right countries, together with the donors, and we follow up if they use it well. To that same country, we gave a little bit later also an evidence exploitation workshop. If they go to a crime scene, what they need to do on that crime scene to protect the evidence. How to transport the evidence from the crime scene to a lab. How to work with other agencies. We always focus on multi-agency approach, because it's not just police, of course. It's about, well, most of the people are not from the police in this room. We need to work together on this. That's what we explain in these trainings. Last time we went back to that same country and we did a border control operation. Border control operation where we explain them how to use our Interpol tools to find terrorists, because that's very possible on the borders with our databases to see who is crossing with a good passport, fingerprints, all this stuff. That country, during that operation, well, we put a biological agent in one of the passengers, let's say, luggage. That country was able to find that biological agent, and they followed the procedures from A to Z, which I think is a success after the training. We also do tabletop exercises with these countries, and what I really like, especially from that CBRNE unit, what they do very well, also the biological team, what they do really well, they don't just give trainings and go home. They really follow up, is there a policy in place afterwards? For instance, with the Ebola crisis, we had the West African country several times with us, or we went there, not only to explain how a policy needs to look like, but we asked them, show me your policy after a few months, or do you have hurdles in your country? So we really followed up from a law enforcement perspective, but with a multi-agency approach, if the training resulted in a good policy. That's how we engage with the stakeholders. Thank you.
Thank you. That's very thorough. I appreciate it. The next question is for Mr. Brooks. So the Cooperative Biological Engagement Program has its roots in the Nunn-Lugar Cooperative Threat Reduction Programs, which were designed to dismantle the research and development infrastructure for weapons of mass destruction in the former Soviet Union. But clearly times have changed and biological threats have changed. So how has CBEP evolved to face changing biological threats? And can you touch briefly on what the word cooperative means in terms of engaging stakeholders at the international and national levels.
Thank you, Julie. And I'd also like to thank OIE and the organizers conference for including us on this distinguished panel and for giving us a chance to be part of this discussion. So thank you. Right. Our program came into existence, as you mentioned, for urgent security need to help the independent states dismantle and secure state-run bioweapons programs. What was quickly realized along with the global partnership, which was mentioned earlier, is that it's not only state-run programs that were issued, but also non-state actors. And we also have emerging diseases that impact national, regional, and global security as well. As evidenced, in times now as populations encroach on the environment and in undeveloped areas, and travel is becoming much easier from some of the recently undeveloped areas of the world, and we're becoming more interconnected. So our program works at the source of biological material, and is evidenced with the members here and in the global community. Biological materials, unlike other weapons of mass destruction, are ubiquitous around the world. We all use them for dual purposes. And another aspect of our craft is that the majority of those have been previously used as bioweapons or also zoonotic diseases, great vast majority of those. So you have to reach a broad audience to focus on biosecurity and biosafety, along with biosurveillance. So there are diseases, as we've seen, and many of the outbreaks you're all familiar with, know no borders. This theme keeps coming up. So a country, organizations can't work independently of themselves. They must work together, especially countries in a region and globally. So we've adopted a systems approach to taking a look at, with the country partners, of where their strengths and weaknesses are in the areas of biosafety, security, and biosurveillance to contain outbreaks, whether they're intentional, accidental, or natural outbreaks that could have an impact on national, regional, and global security. So by systems approach, we look to see where the weaknesses are in the country, where assistance is needed. There's many international partners who provide assistance, who are also working in some of the same countries and regions. There's a lot of efforts that some of the countries themselves have maybe undertaken to start to strengthen some of their biothreat reduction efforts in the country. So I think we all can agree there's as much resources we're putting into this problem, there's limited resources globally to address this problem. So we have to work together cooperatively and be very deliberate on where we spend our investment, and that we're not duplicating efforts, but working together as a community to make sure we're addressing the critical gaps, as I said, in security, safety, and biosurveillance, to be able to early detect and respond to these outbreaks. I also like to say that it's not a new term, but we want to take advantage of networks. We want to build biothreat reduction networks. And network, in a sense, is something that's active, something that works together to address the threat. So if you think about it, it's internally in a nation, intersectorial, multi-sectorial. You need to build a network together to work nationally to address your problem. But also we need to get partners to work together as a network regionally, because there's a lot of travel and transport across borders, and also some of the vectors travel across borders. They don't use passports and visas, so we need to work together in a regional capacity and a threat reduction network. So cooperative means we have to work with our partners. We have to build trust to know that we're going to work together. We're going to stay together to work on the solution together until we have a solution based on our mutual established goals. We can't come in and just try to instill cookie cutter solutions, but we really need to work and tailor so that we have a sustainable approach. And the other thing that our approach, cooperative, means that we need to work very closely, as we do, with the international organizations, OIE, WHO, FAO, and Interpol, because it is a multi-sectorial problem, working both with the public health community, the animal health community, and with the law enforcement community to address the terrorist threats, but also to know when we have an accidental release and discern it from an emerging natural outbreak that could potentially become a pandemic. So cooperation is not only with our partner, but it's also with the regional partners and with the international community, so we all can work towards common solutions together for biothreat reduction. Thank you.
Thank you. And speaking of those international organizations, Dr. Eloit, I'd like to ask you a question about OIE, which has the motto of protecting animals, preserving our future, which speaks strongly to the mission of helping partners improve animal health and welfare by strengthening the capacities that they need to prevent, detect, and respond to health threats. However, preparedness for deliberate or accidental events might have different concerns and different needs. Can you address, as our host for this conference, what OIE is doing to engage both its traditional partners and non-traditional stakeholders in addressing strengthening preparedness for biological threats?
Yes, thank you for the question. Probably for me, the most important word is dialogue. Because now, 15 years ago, approximately, miracle, people understood that the public health sector and the animal health sector are connected. And then we have developed strategies. We have drafted concept note under the famous motto, One World, One Health. You remember? One World, One Health is a little old-fashioned, but now we are moving to a more intersectorial approach. But we have to be sure that this multi-sectorial approach is a reality, not only at global level, but also at country level. And we have also to be sure that this multi-sectorial approach is not only an addition of bilateral approaches. And that means that from the OIE perspective, we have probably to move from a too much top-down approach to a more well-balanced collaborative approach with our partners. Over the past year, we have continued to enlarge our network with collaborating center and with reference lab, for example. But my belief is that we don't work well with them. We are ready to find another approach. For that, we can really share our experience. We can really share our needs. I would like to give you one example. WISE. WISE is a global platform through which we collect information data on the sanitary situation worldwide. And currently, and Dr. Mepitse later today or tomorrow will present you the project, we are currently modernizing this platform. But the modernization is not the single objective. The objective is that this platform could also collect not only veterinary data, but also data we could be useful in order to better address the health issue. The objective is that our WISE, our platform, be used not only for trade purpose, but become also a tool not only for a safer trade, but for a safer world. And you will see that when we will develop the project, we'll have also a specific governance of the project, so that all the stakeholders, all our partners, including member countries, because sometimes we forget the member countries. We discuss with other bodies, we discuss with institutions, we discuss with experts, with laboratories, but sometimes, and too often, we forget our member countries. All of them should be included in the governance of the project so that at the end, the platform, the WAIS platform, be not only an OIE tool, but really a tool for all. And from my point of view, that is a new approach to which we have also to address our activities and our challenges, in particular those related to the biological threat reduction, because that is really a tricky challenge. Thank you.
Thank you. Dr. Tam, we'd like to call on you next to talk about the leadership role that the Public Health Agency of Canada plays in preparedness and response for public health threats, and your perspectives, particularly if you could share with us your thoughts on the biological events that are of highest concern for planning for national level decision makers and national stakeholders, including large-scale events. And then moving forward, what do you see as the highest priorities for sustaining and enhancing biothreat preparedness?
Well, that's quite a complex question. But the Public Health Agency of Canada was established after SARS. So recognizing some of the lessons learned and the need for federal leadership and to coordinate our national response, the agency was born together with the position that I currently occupy. So for the most part, we are concerned with the naturally occurring events. And I would say that our provinces and territories and our local governments and our public health systems and our animal health systems are generally consumed for the most part with the naturally occurring events. But all of those naturally occurring events help us better prepare for the unexpected, unusual, or the intentional. So every day we partner with our animal health partners, CFIA, on foodborne illnesses. Right now, of course, we're also dealing with the issues of decreased vaccine coverage and vaccine hesitancy, which is a little bit new, with measles cases from importation. But I would say every year we're reminded of the global interconnectedness and the emerging infectious diseases that can hit us any time, and always has surprises, no matter how well you're prepared. So we try to learn our lessons after SARS, but the MERS coronavirus kept me up at night just thinking about the fact that if South Korea can have an introduction and into the hospital setting, I wonder how prepared all of our hospitals are in dealing with one of those events. We deal with the occasional avian influenza outbreaks, whereby we strengthen, of course, our response together with our animal health partners. And then the international events of concern, like the Ebola outbreak in West Africa, again gave us a lot of lessons learned. Even though, of course, we knew the risk to Canada was low, we had to prepare, just like all the other countries, for a potential case. And we were sending a lot of responders to West Africa as well. So making sure that we have all of our basic public health systems in place was very important. And of course, the plague in Madagascar was another opportunity for us to prepare for potentially intentional events as well. And so with that, we make sure we were alerting our whole health system, making sure our border quarantine officers and others knew what to do if they encountered a passenger who was sick coming from Madagascar, and our labs were prepared to do testing, etc. So really those naturally occurring instances give us a lot of opportunities to prepare. And we're also working on antimicrobial resistance, which is a One Health approach. And so I think we leverage any of those opportunities to increase preparedness. And so I think the naturally occurring event, we absolutely are supportive of the international health regulations and the core capacity building. And we are going to be undergoing an external evaluation through the JEE mechanism, which is linked to our PBS pathway capacity assessments as well, so that we know how well prepared we might be through a more objective evaluation. In the area of accidental, in 2009, we received royal assent for the Human Pathogens and Toxins Act, and then the regulations were enacted in 2015, which gave us a very robust national regime for managing risk group 2 to risk group 4 pathogens in all labs, whether they're handling animal, except for foreign animal diseases, animal pathogens and human pathogens through a single window. And I think that's a good intersectoral response and allowed us to reach out to every single laboratory in Canada immediately to know, make sure we don't have any smallpox, of course, that's very important, and of course we didn't have any laboratory reporting of that. But we put in place a surveillance system to monitor laboratory incidents, and we will soon have the first year of surveillance information to tell us how many exposures or potential exposures our labs undertake and how many of those we really potentially could be serious. They are actually quite rare, but good opportunities for preparedness. And also, I think, you know, a really good opportunity to reach out to the academic sector and the academic laboratories in terms of training for biosafety and biosecurity. In the intentional domain, there are some special things I think that we do. Provinces expect national leadership, federal leadership when those rare and high impact events occur. So we work very closely across the federal government departments with global affairs and global partnership programs and our animal health and public safety or domestic homeland security sectors and the RCMP. So we rehearse, we plan, we exercise with them to deal with those. But I do want to mention the importance of international collaboration in that way. We are participants of a number of international fora, whether it's the Global Health Security Agenda, the Global Health Security Initiative with the G7 in Mexico, because for those rare things, one country cannot cover off all of those risks. We need to find our niches and collaborate. For example, solving the issues of sample sharing of medical countermeasures. You can't imagine how complex those situations are and demands us to work with the WHO, OIE, and others. And I think in the area of medical countermeasures preparedness, for example, we actually had to leverage the Defense Research Development Canada, because they actually had a means through the bioterrorism lens to provide us with some research funding and a collaboration with African countries in order to come up with the Ebola vaccine and some of the countermeasures that we were able to deploy to West Africa. So I think, in summary, you know, we leverage the natural to build upon the response to intentional. We also need to leverage innovation, whether it's laboratory innovation in bioinformatics, machine learning, etc., early alert and reporting. You hear about some of those international initiatives. Everything that we do must be science-informed. Ebola was driven by fear, and so managing the engagement of the public and some of the other sectors are very important in order to do that.
Thank you very much. I'd actually like to build on what you've both said, Dr. Tam and Dr. Eloit, about intersectoral collaborating across sectors and across organizations, which is one of the themes of this conference. Could you both share your thoughts briefly on what the most important or persistent gaps are in that intersectoral collaboration? And on the reverse side of that, where are the opportunities for really strengthening preparedness through building capacities in that intersectoral space cooperatively? Yes, please.
Probably the main gap is at country level, from my point of view. I think that at global level, our collaboration and partnerships are quite good, even if we could continue to improve it. But at country level, we need more political commitment from the countries. And we have also to continue to invest in capacity building, in country capacity building, without forgetting also some regional or sub-regional coordination, because as Dr. Tam explained, a single country cannot manage alone all the challenges and cannot face all the difficulties alone. Country capacity building, means that we have also to invest in a long term. And for me, two specific domains should be carefully followed. First, education. Secondly, the legislation. Without well-educated, well-trained people, we cannot build the future. And for me, the objective is not to think about veterinary education, but also we have to think to the education of all the paraprofessionals who contribute to the veterinary activity. Education is really crucial. Second main issue for a long-term and sustainable improvement is the legislation. Because legislation is really the skeleton on any action, is really the skeleton on good governance. And we cannot build a program, we cannot encourage twinning, we cannot encourage all our activities at country level if we have not the human resources and the legal basis on which any activities should be built. Therefore, from my point of view, we have to maintain this structure and continue also to build the network of laboratories. Very often we think mainly to the official administration, but not enough to laboratories. And I think that thanks to the support of our partners, we are on a good track.
Dr. Tam, would you like to add to that?
Yeah, maybe I'll just build upon what Monique has said. So in the public health domain, we don't do anything without partnering with someone because we actually don't have that many levers. And so that's actually part of what we do in terms of basic core capacity building, training and education, and also building upon our regulatory regime like the Human Pathogens Toxins Act and regulations. That was a really important piece to put in a national level. And we had to collaborate with all laboratories to do that, whether it's government, academia, private sector, etc. I just want to touch upon the sort of international governance a little bit on the biothreat reduction. So the Biological Toxins and Weapons Convention, while it doesn't have an organization to oversee a specific implementation, a lot of collaboration can take place underneath that in order to increase global capacity and learning from each other and sharing our lessons learned. And so I think that under that umbrella, we've had some great successes, partnering with Global Affairs and our global partnership programs, making sure that public health is at the table, as well as our security partners. This happens also in humanitarian disaster risk reduction. We want to make sure that health is at the same table as humanitarian assistance agencies, for example. And I think that there's always a tension and balance between what we might have to do to increase security in the maximum sense, balancing that with the realities of having to function in daily public health and enabling science and research. So I would say that with that in mind, one of the key areas for intersectoral work is actually with the academic sector. And so we found that with all the laboratories that we try to reach and enhance biosafety and biosecurity, there was a lot of work to be done in the academic sector. They were the furthest behind in terms of actually putting together the necessary governance, the SOPs, the biosafety officers, etc., within the university context. And it is under this umbrella that you also have to address the codes of conduct and responsible research for dual-use research of concern, because we do want the academia to thrive and to continue the research that they need, because we need them to actually tell us how pathogens become more transmissible or lethal. At the same time, you want them to do it really safely. So in this conference, you hear from opportunities like the iGEMS competition. There's lots of different ways in which we can actually partner with academia. And of course, with then industry in terms of development of that research and development pipeline to be actually ready when event occurs. And that's linked to the WHO R&D Blueprint Initiative, for example. So I think those are some of the gaps that I would like to see addressed.
Thank you. Go ahead, Mr. Stevens.
I would like to take the opportunity to also give a little bit of my point of view on the partnership. And, well, partnership, of course, on the international level from Interpol points of view with other international organizations. And I thank OIE, the host, and DITRA. Also multinational platforms such as the UN bodies and the G7, where Canada plays an important role. Next year, wish you all the best with your presidency, by the way. But also that multi-agency approach needs to be done on the national level, as we're all aware. But we need to do a bigger effort, I think, on the national level. I'll give you two examples, recent examples, actually. We went with our team to a country where we did an exercise, and at the end of the day, they really realized they were nowhere. So luckily, it was just an exercise, and based on that exercise, they had lots of lessons learned, but I think we as countries, we don't need to wait until there's an international organization coming to us to bring everybody together. So I really would like to encourage more multi-agency operations on the exercises on the national level. Another example, we are aware that a biological agent was sent to a laboratory in Lyon, France, and the customs were not aware that it was a biological agent, and they tried to open the package. Now, they didn't open it completely, luckily, but another example that all agencies in a country needs to be aware and needs to be involved in that multi-agency approach. That's something I would like to highlight under this chapter.
Thank you. And I think we have time for one more question. And actually, turning to you again, Mr. Stevens and Mr. Brooks, to think about keeping up the momentum, which is the third theme for this conference, and moving forward. So obviously, the pace of advances in biotechnologies are moving forward. And that's critical for developments in health care and prevention. But it's also a challenge in terms of keeping up with the biological threats and creating opportunity for deliberate misuse. So how do you foresee your programs adapting and perceiving this changing biological threat landscape? And what do you think what are your strategies for engaging partners going forward, given these changes?
Thank you. It's actually a good question and one that we get posed quite often, because with so many challenges in this area for biological threats, we're always focused on what the current gaps are and what we have been familiar with of threats that we've faced and are currently facing. It's a little harder to start projecting where technology is taking us and what's the threat of that technology. We have to stop looking at it at one technology, one threat at a time. We need to start thinking of putting our approaches and systems in place and thinking of managing the laboratory and threat reduction in terms of overall biorisk management. We need to put those principles and concepts in place because technically everything we do is dual use, right? So we're doing everything for the good of protecting the animal, agriculture in the country, as well as public health. But then again, as demonstrated over history, it's also been used for state programs and terrorist intent to use these things. So emerging technology, it's good to do a lot of good out there, and we can see that, especially in our field here lately, it's just like the advent of computers. I think I can remember not having a computer to going to something that was massive on my desktop to having something now in my hand that's 100,000 times more powerful than what my first PC was on my desktop. And I think we're in that realm right now in emergence of biotechnology with the advents of whole genome sequencing, synthetic biology, and DIY, that almost anybody now can afford the technology that was limited to very well resourced and funded government and research university laboratories. So it's becoming more commonplace out there. So we need to continue to work and educate the community. We can't think of old traditional ways of looking at technology because quite frankly our science advances are going much quicker than the policies and guidelines can keep up with it. And that's been the history of science, right? Science is really drives the advancement in science, drives that. So we really have to continue to educate the science community, strengthen the public health and animal sector by using some of the most modern technologies that we can for detection that's affordable and is becoming more affordable, and to keep mentoring in biorisk management overall when new procedures, technologies come into the laboratory and into our system, is to continue to do that risk assessment of what it means. And to continue to work with our scientists that are up and coming, current scientists, and then the young community up and coming, is the culture of responsible science. Like I said, everything is of dual use, so it comes down to intent and educating the community. And scientists do it fairly well, but we could do better. Sometimes we discuss problems after somebody has conducted the research and published, and then we all question whether it was ethical or not to do. But that's part of education, biorisk management, and keeping a culture of openness and transparency and having that dialogue and teaching that to be part of your regular laboratory culture and your institutional culture to continue to do that. And we need to work together and have that dialogue and work collaborative together with that discussion. I think technology is going to continue just to advance at an incredible pace, and our legislative government systems aren't set up to function to put guidelines and policies in place that way. It'll be usually a couple of years after technology's come out and been introduced worldwide before we establish a policy. So it has to be a good, robust framework that you're always assessing the risk going forward and practice what I think is really good biorisk management processes. Thanks.
Thank you. Mr. Stevens, would you like to add a very brief remark on that to leave our chair a few minutes to summarize?
Well, first of all, I think it's not only the bio threat going up, but it's the general terrorism threat going up. We all seen what happened in Iraq with IS, Syria. But it's not only there. It's, East Africa is under pressure. West Africa is under pressure. The Philippines, the Islamic State has a city, an island almost in the Philippines as well. So the whole terrorist threat is going up. And we really try to focus on bioterrorism as part of the bigger threat picture. And that's why we have that 5-pillar strategy in place since last year. So we don't change now with the latest threat. I think our strategy projected this higher threat already. We tried to, and that's something new now within that strategy, we tried to see where are the priorities. It was already said in other answers. We need to be sure that all these international organizations, we are not overlapping, but we are not also leaving gaps. And we are working on better analytical capabilities to see where is the real threat, what countries need to be prioritized. We need to sit together with the other international organizations, who's doing what, to be sure that we are not going all to the same countries. And I think we are working on it, so I think that's really well. One of the things I also mentioned in my first answer, threat is going up, and especially on bioterrorism, also with the dark web, that deep dark web on the internet where people can buy whatever they want, also biological agents. Well, together with our capacity building and training department in Singapore, we are giving training to law enforcement agencies how to deal with that dark web. And terrorism and bioterrorism is, of course, part of it. We also focus on social media in our shop. So we try to see always what are the risks, what are the modus operandi, and how we can use it in existing strategies. So that's how we work today. Thank you.
Thank you. Thank you so much to our panelists. And now I turn this over to our chair, Jaspinder.
Thank you, Julie, and thank you to the panel members. So, as you know, the overall theme of this panel discussion was global perspective on health and security, and I think the panel members have done a great job. I will summarize the discussion, and I'll make it quick because I think I'm the only one standing between you and the coffee break. So what I heard is that different agencies are working together in making every person's life safe, but we need to continue to do so. We cannot just stop and be comfortable. I think, as Mr. Stevens said, the threat keeps going up, so we need to keep our efforts accordingly. And, from focusing from people to weapons and materials to engaging member countries in providing training to intercept, stop, or reduce biothreats, I think that is the effort that agencies are doing, working collaboratively at the international level. And we saw that there's a lot of effort at the country and regional level that is happening also at the same time. Biological materials are important as chemicals, or nuclear weapons. So we need to be very cognizant and keep reminding not only the scientific community, but also educate people in the public health and also in the veterinary public health domains, because of the dual use. We'll see that later this morning. We need to make sure that everybody's using that for the right reasons, not for the wrong reasons. Specifically, the biothreats or biological materials that are of zoonotic importance, I think that is very important to keep in mind, that they can cause damage on all sides. Cooperation at the local, regional, and international level is very, very important. I think we saw that this morning, how important it is to complement the efforts, not duplicate, but make sure that we're all working towards the same goal. International organizations can play an important role to bring everyone together by adopting a balanced approach to tackling this problem. But we also heard that international organizations are important, but working at the national level, different agencies collaborating and cooperating together, I think it's very, very important too. And organizations and agencies are continuously preparing to tackle these threats. But we heard that we can never be prepared enough for these threats. We need to continue improving our systems from lessons learned from the past, and incorporating those lessons into the new exercises that we conduct to be prepared. And we saw examples of SARS and Ebola and even influenza problems in the past, and saw examples how we are incorporating those lessons in our preparedness. And with that planning and preparedness, by engaging and collaborating with partners is key in following the global health security agenda. I think it's very important that we continue to do so. And we want to make sure that, I think I already alluded to that at the intersectoral cooperation at the country level, we need more political commitment and continuous investment because of the importance that the threats are not decreasing, they're increasing. The continuous investment and engagement by our political side of the countries is very, very important in building capacity at the regional, sub-regional level for the long-term preparedness. We can't keep an eye on what we are doing now. We need to actually continue to look in the future. and having good legislation to ensure right use of biological materials, good awareness and education are key. Public health partners and animal health and security sectors, they need to work together, and at a multi-sectoral level, I think it's very, very important. We cannot keep working in silos. We need to cooperate and collaborate with each other. Academic sector can play a very, very important role in collaborating and working with the rest of the sectors to be prepared and counter these bioterrorism threats, and making sure that there's the right use of biological materials. And multi-agency operations and exercises are important at the national level, and don't wait for the international organizations to come and ask you to prepare. Continue to do preparedness at your level, at the local, regional, and national level. And I continue to educate the science community and strengthen public and animal health systems, and continue to invest in the future. And we need to ensure that international organizations are not overlapping, but also we are not leaving any gaps. So collaboration, I think, is very, very important in using, making complementary activities, not overlapping, but also not leaving any gaps. So that was very good. Thank you, members of the panel. And we all thank you for listening this morning. I think it was very, very interesting.